The dumbbell front squat is a great multi-joint exercise that recruits most muscle groups, but it focuses on the lower body. This video is going to cover the benefits, the muscles worked, technique, and common mistakes when performing a dumbbell front squat. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the progression of diabetes. Although the main muscles involved in the front squat include the gluteus maximus, quadriceps, hamstrings, and erector spinae, there are many more stabilizing muscles throughout the body, from neck to foot, that are active as well. Since the front squat requires an upright trunk position, this is going to really engage our core muscles, including the abs and lower back. When we say core, the anatomical core is referring to the axial skeleton and all of the soft tissues that originate on the axial skeleton. In the fitness world, this term is often used to describe the abs and lower back. Strengthening the core helps to improve balance and stability, which is particularly important for older adults and athletes. The front squat is a functional exercise for most people, meaning that it mimics everyday activity, which, if done on a regular basis, can make daily tasks much easier. Let's shift focus now to technique. Stand with your feet shoulder-width apart, toes pointed out to 30 degrees, hold a dumbbell in each hand with palms facing one another, bring your elbows up so that your upper arms are parallel to the floor. With your chest to the ceiling and abs braced, begin to squat down like you're sitting in a chair. Keep your knees in line with your feet to prevent unnecessary stress on the knees, and go as low as you can safely go, with the ultimate goal of having your hip crease drop below the top of the knee if possible. The neck should be in a neutral position with eyes facing forward. Please give me the thumbs up and hit subscribe for more free content if you're finding this useful. Once you've gone as low as you can safely go, stand back up, keeping your knees in line with the feet and pushing your elbows towards the ceiling. Inhale as you descend and exhale as you stand back up. A variation of this movement is using only one dumbbell and holding it to the chest like a goblet squat, but with the elbows pushed upward. In a study that compared the barbell version of the front squat to the back squat in Bodybuilders, the front squat resulted in more muscle activation in the gluteus maximus, gluteus medius, and erector spinae during the downward phase. This was in comparison to the back squat performed at similar depth, at parallel, and comparison to a deep back squat well below parallel. More activation occurred in the rectus femoris in the upward phase of the front squat when comparing it to a deep back squat. The author suggested that most of these differences in the downward phase were likely attributed to a more vertical trunk position in the front squat, which likely requires more stabilization from the hip extensors. There are some common mistakes related to the dumbbell front squat to keep in mind. The most common error is letting the elbows drop, which causes the trunk to lean too far forward. Excessive forward lean can put too much stress on the lower back, putting you more at risk for injury. A good coaching cue to correct this is to push the elbows to the ceiling throughout the movement. Another common mistake is using a weight that's too heavy. If you find it difficult to keep your upper arms parallel to the floor throughout the movement, it might be an issue of using too heavy of a weight. The dumbbell front squat is an excellent full body exercise that targets the lower body, and it can be done from home. Including multi-joint exercises such as this into your strength routine can help you to save more time because you're working more muscle groups at once, and it's also a very powerful strength stimulus. Thank you for watching.